Well, I'm a hearing specialist. I'm an audiologist.
Okay.
And I was always interested in this subgroup of children who have normal hearing sensitivity, yet they don't hear normally. So that's what we call auditory processing disorder. So, you really hear with your brain, not your ears. You can pass a hearing test. So the child hears a beep and they raise their hand, and that's a test of hearing sensitivity, similar to a child who gets a vision test and they have 20/20 vision. That's a test of acuity, but it doesn't tell us how functional your hearing or vision, whatever the case might be, are. How do you process information through the auditory channel? That's what I'm interested in. So when you have auditory processing problems, most likely you're going to have some difficulties with reading. Very often these kids have histories of speech delays, articulation problems. Some of them have histories of early middle ear infections and problems, and that can contribute also. And sometimes these kids will do great in a one-on-one quiet situation where there's no background noise. But put them like in an echoey room, like a gymnasium or a noisy place like a restaurant or whatever, or classroom, and very often everything's kind of like Charlie Brown's teacher, wah, wah, wah. And it's hard for them to understand. And then they hear a few words and then they miss a few words. And after a while, they're trying to piece it all together. They get so tired of listening, they tune out. And very often they develop bad listening habits because they have trouble hearing. And the next thing you know, people think they have attention deficit disorder. Sometimes they do. And then, it just kind of progresses and spirals into all kinds of behavioral problems and unfortunately, low self-esteem, poor academic progress, and so forth. Oftentimes, these children have very poor auditory memories. So you'll tell them, go to your room and put on your pajamas and bring me a book. And the child goes to their room. And they're staring at the ceiling wondering, what was the rest of that message? What am I supposed to do when I get over here? And then it seems like they're not listening. Then they get distracted by something else again because I don't remember really what I was told to do. So while I'm up here, I might as well fiddle around with some other things that I have at my disposal. And then one thing kind of leads to the other. But very often these kids will say, what? What? Huh? Huh? I didn't hear you. I didn't hear you. You get that a lot. Or oftentimes they'll say things like, I don't get it. You've explained it 5 times and they're still looking at you. They heard you, but they don't understand. They can't comprehend. So part of it could be a language issue too. It's rather complex. Well, technology is not a friend in the sense that oftentimes these children are very attracted to technology. They like to watch all these, YouTube videos. They like to play video games and so forth. And these are things actually that can interfere with auditory processing by overstimulating certain parts of the brain, yet understimulating other parts of the brain. In a particular type of auditory processing problem that boys in particular tend to be very fond of video games, and I can almost guess what kind of auditory processing problem they have just based on what their preferences are, what they like to do in their leisure time. One of the biggest problems that we see in auditory processing is that the right and left auditory areas of the brain, the left halves of the brain, are not connecting well together. They're not talking to each other. So each half of the brain does different things. The right side of the brain is more interested in how you said what you said, your tone of voice, your facial expressions, the emphasis that you use, your body language, things like that. The left side of the brain is more interested in the data. What are the facts? What exactly did you say? So if I said to you, oh no, that's just great. Or I said, oh yeah, or no, oh that's just great, or something like that. Not the no part, but oh that's just great versus oh that's just great. Even though I've said exactly the same thing twice in terms of how the left brain hears it. Why did you say the same thing 2 times? My right brain goes, no. Did you see her facial expressions? Did you hear the tone of voice and the emphasis that she used when she said that? She's being sarcastic, or, she's being humorous, or she really means this, or whatever it is. So in order to get the bigger picture of what's going on, you need this interhemispheric integration. When we do a lot of, like, for example, technology, data, digital information goes more to the left hemisphere of the brain. And so it hyperstimulates the left side, and the right side doesn't get enough stimulation. So then we end up with some very unbalanced processing skills. The Journal of American Medical Association, JAMA, which is very prestigious, put out an article about how use of electronics to calm kids down, or sometimes we give them we put the cell phone in front of the child to try to get the child to eat because they won't eat, they just keep opening their mouth and watch the video, and whenever we want to calm them down, we keep giving them the video, that this may be impairing their ability to learn how to self-regulate, learn how to control themselves, calm themselves down emotionally, instead of constantly having to have something external to keep them entertained so that they don't have a tantrum or whatever the case might be. I mean, this is a problem. So that's like an indication to me that the right side of the brain isn't really developing. We're over challenging. It'd be like exercising your right arm all the time at the exclusion of your left. You're going to have an asymmetry, and then you're going to misunderstand a lot of, and especially like when kids get into 3rd, 4th, 5th grade, the language becomes more complex. There's a lot of multitasking going on, many things that you have to remember, items in a sequence that you have to do, put your name and date at the top of the paper and in the left-hand column number from 1 to 10, and skip every other line. Now you have to visualize, and you have to hear this, and you have to put this, you have to understand what this all means. And that's where these kids are just really falling short. So they're very literal, many of them very concrete, and they have trouble in social relationships. Sometimes they misunderstand information. Their feelings get hurt easily. Somebody could be kidding around with them, but they take it very seriously and personally because they don't understand that this person is just joking around with them. And so it causes all kinds of problems, not just academically, but emotionally and socially as well. They have trouble learning how to read by phonics. Sometimes too many sounds sound the same to them. Like, for example, in the words dime and time, right? Sometimes they don't hear this little voice onsets of a D, like that that you say before you say that D sound. So it sounds like dime, dime to them. So how are they supposed to learn how to read? So many sounds, they look different, but they all sound the same for me. How do I know which one to put down? Wow. And they misunderstand, or they might mishear something. You might say to the child, just put it in the back, and the child stuffs it in a bag. And you say, and what are you doing? I told you to put it in the back. And the child says, no, you didn't. You said put it in the bag. And you never listen. What's wrong with you? Why don't you ever listen? You're disobeying me. You're not trying hard enough, or whatever it is. And then what happens is then the child kind of becomes a living legacy of that. Right. Their self-esteem tanks. They're not interested in reading. Wow. They feel like they're letting people down. They don't know what's wrong with them. They blame themselves because nobody else really understands the deeper meaning, and nobody's really screening for this. And so therefore, a lot of times these kids are flying under the radar. I bet if you went into our prison systems, you would find a lot of people with auditory processing disorder. We are excited about the fact that we're learning more and more about this beautiful thing called neuroplasticity, which is the brain's ability to change itself, and that we have neuroplasticity throughout the lifespan. Of course, we have the greatest neuroplasticity when we're young. And so it would be so great to be able to identify kids at a much earlier age than we do right now for auditory processing disorder. And I'm working on some other areas so that we can hopefully start to identify kids at younger ages, even as early as 6 months of age. By 6 months of age, I'm looking for a baby to really be able to localize sounds pretty well, at least on a horizontal plane. So they hear a little sound that they turn and they look. They hear it over here and they turn and they look, even soft sounds by 6 months. Okay. And if the baby is not localizing for sounds by 6 months and not babbling, like da, 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 ba, 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 ma, 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 those are big red flags for me. When parents say to me, oh yeah, he was a really good baby. Yeah, he was really good. I said, what was that? Well, he was really quiet. He never cried and blah, blah, blah. And I'm thinking, no, I don't want good babies. I want good babies, but I want babies that are vocalizing, trying to get their needs met, interested in getting into things, exploring, trying to get your attention. Those are really important things. So, and then I mentioned a little bit about middle ear problems. So we have a lot of kids that are kind of flying under the radar with fluid in their middle ears. And their pediatricians oftentimes will say, oh, no biggie. It's just fluid in the middle ear. It's not infected. But fluid in the middle ear is causing a hearing loss, right? Stuff your fingers in your ears and you can still hear. And we as adults, because we've been listening to speech and language for so many years, we have great redundancy for language. So even though we don't hear every single word, we can kind of figure out what the person is saying with what we call auditory closure. But little ones who are just developing their sound encoding system, they can't do that the way we can. So a 15 decibel conductive hearing loss on a child, although that might be mild for an adult, it's a big problem for a school-age kid, especially when it persists month after month, sometimes years. Sometimes the fluid turns to what we call a gluey substance. We call it glue ear, which really causes a major hearing loss for these kids. And not only that, but it affects their balance system. And then the balance system controls eye movements. So that's how this whole ball of wax fits together.
Okay.
So then we start to see this triad over and over again of kids with auditory processing disorder, attention deficit disorder, visual processing disorder, over and over and over again. What comes first, the chicken or the egg? But sometimes if you look back, you're going to find that the child had a history of middle ear problems, that the doctor said it wasn't a problem, he didn't need surgery, it wasn't infected or whatever, just leave it, it'll go away. But do they really follow up with these kids the way they should? Or is this child walking around with like 2 earplugs? You know, there's a very famous study that was done a number of years ago. These guys got a Nobel Prize for it, were Hubel and Wiesel. They took a kitten from birth and they checked the kitten, they anesthetized it, they ran some tests on it, and they found that it could see. You know, the visual cortex was lighting up when they were flashing lights or whatever with this cat. And then they sewed one of the kitten's eyelids shut for about 6 months. And there was nothing wrong with the physiology of the cat's eyes, right? And then 6 months later, they opened up the kitten's eye, and it never saw out of that eye because it had visual deprivation, and because of neuroplasticity, the brain had rewired itself based on the information of the good eye and had pretty much discounted the other eyes. So the same thing, why wouldn't the same thing be true of the auditory system? But nobody looks at that, which is why I think it's really important that we start doing screenings earlier and that we do, you know, preschool screenings and children that are in daycare centers. We need to check these kids to see. There's some simple tests that we can run on these kids called an OAE, an otoacoustic emission, that just takes seconds per ear. That would give us so much information. We could flag these kids instead of them going for long periods of time with auditory deprivation, hearing deprivation, and then their neurological systems are not developing appropriately because they're not getting a good signal through the auditory channel. Well, I think the beautiful thing about Bright Minds processing is that the people behind this are trying to bring these issues to the forefront. There are so many kids who are struggling with learning disabilities and behavioral problems, and we're blaming the kids instead of looking at the bigger picture about what might be underlying these problems. And that if we could be able to screen at earlier ages for some of these difficulties, we might be able to prevent a train wreck from happening, you understand? We might be able to go in there and start and turn that train around before it really goes too far off the track. So early intervention is the key for all of this. And, you know, with all due respect, pediatricians really need to do a better job of screening for these types of problems. When a baby is born, has a normal hearing test, they pass in the hospital, it doesn't guarantee that their hearing is going to stay normal. So then sometimes I see the child at 3 years of age and I'm told, oh yeah, he passed his newborn hearing screening. That was 3 years ago. I mean, there's so much that goes on in that early time of development that we really can't afford to miss anything. And these tests that I'm talking about, for example, the OAE, otoacoustic emission, is such a simple test to run and takes such a short amount of time. And the cost for that test is so much less than what it's going to cost to educate this child down the line, not to mention the long-term effects on the child and everybody else that the child comes in contact with who struggles with the behaviors of that child. So if If this program is as successful as I hope it is, this Bright Minds processing, in bringing this information to the forefront, hopefully we'll have earlier identification. Kids that are at risk will be followed a little bit more closely. Instead of checking them once a year, we'll be checking them every 3 months just to make sure that they stay clear. And hopefully get them through those first 2 years, which are the most critical for our development, that's sensory and motor development. When we miss that time, it's hard to go back. And yes, we have neuroplasticity, but it's very difficult to completely go back and reinvent these pathways.